Thank you so much for asking me to speak today. I want to absolutely applaud NHS England London for arranging this event. I'm a registered nurse, I'm still a registered nurse. I'm in my 31st year of working for the NHS and I could not be more proud of the work that you all do. I think for me, as my career, perhaps, I've got a few more years left in me yet, but I know already I will look back on my career and think, I made a difference, I work with people who made a difference. But I've been really tired in recent years of feeling that the world is telling the profession how to behave, what its values are. And I think this event is about the professions, and I know it's not just nurses here today, reclaiming the territory and saying, actually, this is what we value, this is what we do. So huge congratulations for the organisers of this event. In my own trust, with that in mind, last year we ran a big programme called The Conversation. What I didn't want was the trust board to be telling staff, these are our values, please live by them. So we ran a massive conversation where we said, tell us what our values should be. We've got 4 values, new values, but they're not new. And the top amongst them, in terms of what we got back from porters, ICT technicians, nurses, doctors, OTs, physios, etc., consultants, was compassion. So our top value since last year is compassion. I do just want to say that compassion, when you look up the different definitions of it, are very much about coming along with. Com means with, alongside, suffering alongside, feeling someone suffering. But it's more than that, because that can be quite passive. There's an active, it's a doing word as well. It's about wanting to alleviate that suffering. I think we should take compassion further than that, though, because it's about promoting health, well-being and understanding people's aspiration for their life. Even at the end of life, it's not all about suffering, it's about living. When we introduced about 6 years ago into our Band 5 assessment centres recruitment for compassion, absolutely explicitly recruitment for compassion, the Nursing Times and 1 or 2 other journals got interested in it, and I was and ran a few articles, and I was astonished how much came back from nurses, not just in the country but from across the world, saying, well, you can't possibly recruit for compassion, you can't measure it, and so on and so forth. And that pulled me, and at that point I went, well, you can actually. And Einstein said, just for your information, it was Einstein, much cleverer than me, by a country mile. He said, not everything that counts can be counted. He also said, not everything that can be counted counts. So I think we resolutely stuck our chins out and said we can. And at that point, we put carers and service users on our Band 5 assessment panels and said, you tell us, does this person have compassion? But I think compassion is more than a heart thing. I think it's a head thing. When I was looking up the definition of compassion on Wikipedia last night, as you do, it said there, often it's just associated with something emotional, but you can associate it with the cerebral. Because notions of justice, interdependence and fairness are all rational notions and all sit at the heart of compassion. And therefore we can take forward compassionate activity in a very rational way based on sound judgment. I think there are 3 areas where that sound judgment with your head comes into play. One is, it's caring, it's ethical, it's what defines us as being human. And I think the more that you nurse or care for people in a compassionate way, the more you are likely to recognise this as an intensely human activity. And I think that's really important. And you're likely to get better patient satisfaction results and so on and so forth. People will feel you've cared for them. I think it's clinically effective. I think there's a huge body of evidence that will say, if you're compassionate, you're going to be really interested in the person in front of you. You're going to notice if they change colour. You're going to ask them what their health is usually like. You're going to get all sorts of clinical information that's going to enable you to act in a timely way based on evidence to intervene early. And there's a massive body of evidence that says early intervention at any stage of a pathway is likely to bring better patient outcomes. I also think it's cost effective. It's cost effective because intervening early and doing it in the right way will save you a fortune in complaints handling. and litigation. It will save you a fortune in terms of missed opportunities and care becoming more complex because we've not listened sooner down the pathway, and people having higher needs, much more expensive. So I think on all levels, compassion is the way to go. I think boards, being a chief executive, need to recruit for it, need to appraise for it, need to nurture it, and need to recognise it. I think individuals need to have the courage to align themselves with the suffering, the hopes and the aspirations of others to promote well-being or to alleviate distress at the end of life. I think it means individuals being nurses, practitioners, being really curious about the person in front of them. And you need courage to do that sometimes, because the distress, even the hopes of others can sometimes be hard to bear if you feel you can't address them. I just want to end with a really personal story, if I might. I'm one of 6 children, and I can't tell you how much I loved my dad. I was a daddy's girl, absolutely, definitely. And he was told one day out of the blue that he had a huge aortic aneurysm. And I was there when the doctor said to him, "Mr. Murdoch, if we operate, you'll probably die. And if we don't operate, you'll definitely die." And the doctor quivered and had virtually a tear in his eye. My dad leant forward, in fact got out of his bed and said to the doctor, "Thank you very much, young man, for telling me that. That can't have been easy for you." That was the mark of my dad. Anyway, he went into surgery. It wasn't an aortic aneurysm. It was a massive cancer the size of an orange near his heart. He went into intensive care, and he was there for several days. And during his time in intensive care, you can only imagine the bedside vigil with 4 daughters, 2 sons, all of us adoring, and all of us hoping he would come through. But during that time, I had the privilege of watching the intensive care nurses at work, probably some of the most technically competent and skilled and experienced nurses in the NHS. There are others. We employ many of them in the community. But I watched them at work. They were amazing. Father's Day came, Dad's still unconscious. You can only imagine what we wrote in our Father's Day cards, the messages of love and hope. I was the last one to leave him on Father's Day, and I positioned the cards at the end of his bed because I thought if Dad does wake up, I want him to see our cards. I came back. I was the first one of my brothers and sisters back the next morning. I went into my dad's room. Nurse was sat by Dad, and his cards are gone. They're gone. How very dare the hospital take my dad's Father's Day cards away. And I said to the nurse, "Morning, nurse. Morning, nurse. Where are Dad's cards?" And she went, "Oh, they're here. I was just reading them to him." And I thought then in that instance that nurse was nobody, there's not a KPI in the world that could have induced that intensive care nurse to pick Dad's cards up in a quiet moment and read them to him. I like to think she thought that when you're dying or you're in intensive care, your hearing is still a very active sense very often. I think she'd realised how much his family meant to him. And I cannot tell you the great comfort that we all took from thinking, well, when we're not here, I bet they're really caring for my dad. So I want to thank that nurse. I want to thank all of you who practice in that way every day unseen, including in people's homes in the community, which I am going to bang on about a lot throughout my career. And I want to just conclude by saying we all need to have the courage to practice compassionately under pressure, more productivity and so on and so forth. And it was Winston Churchill who said, just to end with another quote from a great man, he said, "You make a living by what you get, and you make a life by what you give." And I think there's nothing finer than being technically excellent, really clever, really clever people go into healthcare, but doing it with your heart and practicing in a compassionate way. And thank you so much for giving me a chance to speak today. Thank you.
Before the session, Claire was saying, "I'm not sure that I can do compassion in 5 minutes." I think she just proved she can.